old fossil, not a dinosaur. PA fossil. And the PA fossils are the ones that are on the inside of caves that you can scrape off that still move around. So that would never be me. Because I was lucky enough to be involved with PA education back more than 50 years ago when the profession started in the late 1960s. Speaking to you all as students, and this you are, as several have said, are the focus of today, you obviously chose this profession of medicine because you wanted to be healers. You're all smart, you could have done IT, you could have done all kinds of other things, but you chose medicine. And the profession of medicine really is about healing. So congratulations on making a great choice. Give yourself a round of applause. Now the white coat ceremony is very, very special, as has been said by several. It has not been around all that long. It was formally started in the 1990s at Columbia University Medical School, where they had the bright idea, which I think was wonderful, that we should celebrate going from the primary academic Valerie Berry type years to, that's a compliment, to the clinical years. And let's make a big deal out of that. And so they came up with the idea of a white coat ceremony, and PA programs around the country adopted it. So that's where that has come from. I want to tell you that it wasn't always that way. There are a few doctors in the audience who I think will agree with me on this. When I was a second-year medical student, which was 1963, now I know none of our students were born yet. I remember a drug company, this is back when drug companies could give you things like this, gave us all a black medical bag. And it was filled with all kinds of stuff, some of which I still have around, some of which you might recognize, to knock on people's knees, and tuning forks to check their vibration sense, something like this to maybe draw blood. And I was talking to one of my older doctor friends today. They said, yeah, we had needles and things. In fact, we reused that stuff. But then when we went out to our rotations without much fanfare, they did have to give us something to wear. So they did give us a short white coat. And the thing about the short white coat then, as opposed to now, is we filled it with all kinds of stuff because we were so terrified that we wouldn't know what we were doing on the one hand, and we had to do all this stuff work like draw blood and do things. So we had books jammed into our pocket that if you open this, it has every disease known to man and what to do about it. And we had a stethoscope, and we had, one of my favorites was this pharmacopoeia that has every drug known to man at least 30 or 40 years ago. The print has gotten a lot smaller. So I can't read it at all. There was a pen light. There was something called a tongue compressor. Say ah, all of you, 29 people say ah. Very good. And then, as Nicole has pointed out, the most important thing to have in your white coat is some sort of bar of nutrition, because who gets to eat when you're a student? So that's how hard it was back, in the 60s. And this was true in the 60s, the 70s, the 80s, not only for medical students, where we felt inadequate and needed to try to buttress up our sense of self by having all this knowledge available to us, even if it was 40 pounds. But the PA programs were the same way. And so your original PAs that started this marvelous program also had white coats that were worn down and very, very heavy. Now today, the white coat that you'll be putting on, you may have a stethoscope in one hand, but you'll have just something like this in the other. So when your preceptor says, all right, Josh, or John, or any one of you students, what are the 16 causes of hypercalcemia? You can just say, Alexa, Siri, Christopher, Valerie, Nicole, Kendra, and there you are.
I'm still not sure about
That shows how well I do this. In my case, I say, Eddie, can you please tell me? She's my wife, I'm a nurse practitioner. What are the 16 causes of hypertension? What is the latest insulin dose of whatever, since she's a diabetes specialist? So you have this in one hand with some good apps, admittedly up to date, and there are some things like that. You don't have to depend completely, but it's a very different atmosphere and ballgame. I think I'll just put these things back here for now. The common thread for all of us when we first went into clinical years, I've alluded to a little bit, but it's what I would call the I word, the sense of inadequacy. I just don't know enough. I know I studied very hard, but what if I miss out on the diagnosis here, or I don't really know what I'm seeing in front of me? That is universal. So just accept that's normal. That's not you. And the way you get around that and deal with that is, first of all, to just accept it, but then ask for help through your iPhone, if you wish, or through your preceptors, through your fellow students. Make some calls, look up a journal article. Don't expect to know it. And one of the reasons that this is not just true for next year, but you might as well get used to this pattern of behavior, is this is the way medical practice is in whatever field you are. There's always new knowledge, and there's always more to keep up. So what you really want to learn next year is this process of learning and a sense of lifelong learning that will be good for you going forward. I remember, for example, I'm old enough to remember, there may be a few doctors in the audience, where I did a surgical internship first before I did a medical internship. And when we had an abdominal pain patient, we couldn't figure out what was going on with our physical diagnosis exam, we would just do something called an exploratory laparotomy. We just make a big incision, open the patient, and look around and figure out what was going on. Oh, diverticulitis, oh, appendicitis, oh, bowel obstruction, and fix it. There's never been an exploratory laparotomy in America, I don't think, in 30 years. We have CT scans, we have MRIs. The same is true in medicine. Some of the diseases where we used to operate on, like ulcer disease, they discovered there's something called Helicobacter pylori, a pathogen that could survive in the stomach. And the person who first described that was laughed out of the room when he gave the presentation, later got the Nobel Prize. And so we now treat ulcer disease with 10 days of antibiotics and a few other medicines. There's no more opening up the chest to take out half of the stomach. So in your lifetime, you're going to see the same kind of changes in medicine. You'll be part of helping to create those changes. The other I word is, I want you to get comfortable introducing yourself. Because when we started out in the fossil years in the 70s, it was very important for us in doing faculty work to tell everybody at the medical school, for example, or everybody in the community, that these new PA students would be doing diagnosing and treating, they'd be doing histories and physicals, and introduce the PA students as best we could to these new rotations. That has been accomplished so well that we now have 238 plus accredited PA programs nationally. Let's have a round of applause for that. And 130,000 plus certified physician assistants working in all 50 states and some of the other areas in the world. Let's have some applause for that. Now still, though, when you go out on your rotations, most people will know what a PA is, but they may not be very clear of what your role is. So I want want you to get used to when you go in to see a patient, if they have any question, you're wearing a white coat, you might look like a doctor, you might look like a nurse, you might say you're a PA, they may know what you are. Say, my name is Fred Sadler. I work as a physician assistant student. I'm part of the CSUMB Master's PA program. I practice medicine with an interdisciplinary team. Something to that effect. Make up your own version. But in about 2 sentences, make the person comfortable, educate them. And you may, in the first week, need to educate your clerkship people as well. One of my favorite stories of what a student can do. Here's what brings tears to my eyes, so sorry. Dick Hall is a first-year Yale PA student. We had 5 in the first class. And if you think things were chaotic in your first year, we were about 1 week ahead of the students in the curriculum. When we wrote the curriculum again, we said, what do they need to know next Friday? Let's work on that. But anyway, Dick was in his second year at clerkship. He was called to the emergency room on a Friday night, very busy, very hectic, as you can imagine, at Yale New Haven Hospital. And there was a woman there lying on a gurney on her back, sedated. She had an obvious compound fracture of her left lower leg. It was splinted, it was taken care of temporarily. She was going off to the operating room. And his preceptor asked Dick to do a physical exam to the extent he could on this patient. He started at her head and put his hands behind her head, and there's blood on his gloved hands. And he became immediately concerned about her head injury, which apparently everyone else had missed because they were so interested in her awful-looking leg. He got help. They ran over. They assessed her situation. She had a compression skull fracture. Said, yes, she needs to go to the operating room, but she needs to get her head fixed first. We'll work on the leg later. So that word got around Yale Medical School, Yale New Haven Hospital. In 24 hours, 48 hours, the PA program was a big success. A PA student found something life-threatening that everyone else had missed. So you're going to have the same opportunities when you're a student to pick up something that someone else has missed. It may be life-threatening. It may not be. It may be something that relates to the patient's history or to their family or to how they're using their medicines. But don't be afraid to speak up, even though you don't know all the answers. If you see something or hear something that you think is important to the care of that patient, speak up to your fellows and make a contribution. It's going to be very exciting to hear your stories coming back from what you've done this coming year. The other message I'd like to leave with you as students, as clerks, comes from one of my favorite professors, who's named Faith Fitzgerald. She's a professor of medicine at UC Davis Medical School. She's a renowned lecturer. She was taking her fellows and residents and medical students on rounds one day. They had a lot of patients to see. There was a little old lady who was now doing a little better. She wasn't quite ready to be discharged in a hospital room. And the student said, not a very interesting case. We've already taken care of her problem. Let's go on to the next one. So they went on to the next one, and the next one, and the next one. And then later that day, Dr. Fitzgerald went back to the room of this patient in her 90s and said, what's going on with you? Got some more history. And found out that she had come to America on the Titanic. She was a survivor of the Titanic. Nobody had gotten that history. Not that necessarily directly related to her chief complaint. Everybody swarmed into her room to hear the stories of what it was like surviving the Titanic. So when you see a patient, oh, just another case of hypertension, it's just another case of diabetes. Is it? No, it's a person with some disease or multiple diseases. And maybe you can't make, as a student, particularly in your first few rotations, some dramatic change in their medical or surgical regimen, but you can learn about them and what makes them tick and what makes them take their medicines or not. And you can develop a heart-to-heart connection with that person, which will make them feel better, them heard, and will make you feel better as well. And you're going to be taking an oath in a few minutes, which is a marvelous oath for students that's been modified from a medical student oath from New York. And I'd like you to take that with you and keep that with you. So when you are concerned or down or not quite sure where things are going, I want you to have that oath with you. Because I think you'll agree it's very, very good. That's very inspiring. And the last thing I'd say to you is to be sure that when you feel anxious and you feel down, which you always are going to have happen to you from time to time, remember the things we talked about breathing, relaxation, breathing. Just pause and take a breath, take care of yourself. And then ask for help, whether you do it from Eddie or Siri or Valerie or Christopher or up to date. Don't try and solve, and then whether it's an emotional problem, maybe you're just down. I need to talk to somebody. Talk to somebody. Don't keep it bottled in. You are going to have a most memorable year